So how are things going? Good?
Okay, yeah, hanging in there.
All right, so she seems pretty content.
Yeah, right now. Huh?
Aw, she's adorable.
Oh,
She's so
thanks.
sweet. Oh, aren't you a pretty girl? Yes, you are. All right, so I'm just going to start with asking you a few questions since it's your first visit.
Okay.
After having her, we just need to get a history and things that went on during your pregnancy, okay?
Okay.
All right, so prenatal care. Did you find out, you were pregnant right away and start prenatal care, or was it more later in your pregnancy?
No, I knew pretty soon on and started taking, vitamins and things.
Okay.
Pretty soon.
Okay, good. So you took your prenatal vitamins all through your pregnancy?
Yeah, I'm still taking things now.
Okay, good. Any infections during your pregnancy? Group B strep or syphilis or hepatitis B, anything like that?
Oh, no.
Okay. Any medications you took during your pregnancy?
No.
Even like a Tylenol or Benadryl or Claritin, anything like that?
No.
Okay. Any drugs, illicit drugs, any pain medicine like a Percocet or a Vicodin?
Oh, no.
No? Okay. Any alcohol use?
No.
Smoking?
No.
Okay. All right, good. All right. So how old are you?
34.
34. And how old's father?
35.
Okay, good. All right. So tell me a little bit about labor and delivery. Did you go into labor naturally? Were you induced?
I went in naturally, and then they ended up doing a C-section.
Oh, okay. All right. So obviously they gave you the epidural anesthesia. Any problems with that at all?
No, that was all fine, yeah.
Okay. All right. So is this your first pregnancy?
It was my second.
Okay.
Yeah.
And Emily has a sibling at home?
Yeah, I have a son.
Okay. And how old is he?
He's 6.
Okay. Good. How's he doing with the baby?
Pretty good. I mean, it's an adjustment. But
Yeah.
he's, doing pretty well with it.
Oh, good. Yeah, it's a big adjustment for everybody.
Yeah, it is.
Okay. Did anyone ever tell you during your pregnancy your RH factor, whether you were positive or negative?
If they did, I don't remember.
You don't remember? Okay.
Yeah, sorry.
All right. No worries. All right. So how old was Emily when she was born? How many weeks were you?
I was 39 weeks.
Okay. And do you remember how much her birth weight was?
I have it written down.
That's okay.
Yes.
That's okay. We have it on her growth chart, so
Okay.
we'll go over that.
Okay.
How many hours were you in labor? Were you in labor for so long and then they did the C-section?
Yeah, I was 18 hours.
Okay. All right. So Emily's newborn screening, did everything go well with that?
They said everything was fine. Nothing
Okay.
showed up.
Did you ever have any genetic testing done on Emily? Or when you were pregnant, any genetic testing at all?
Everything all the testing they did, they
Was
said
good?
was fine.
Okay.
Yeah.
All right, good. She passed her hearing test?
Mm-hmm.
Okay, good. Do you remember her APGAR scores when she was born? That's something some parents know and some parents don't know, so.
They said it was fine. I think it was a 8 or 9.
Okay, yeah, those would be good scores.
Okay.
Those would be good scores. Okay. So any post-delivery complications with Emily? Like did she swallow any meconium fluid? Any respiratory distress, hard time breathing, any grunting? Was she jaundiced at all after she was born?
No,
Okay,
none of those
good.
things came up.
Good. And then how long were you in the hospital? When did you get discharged?
We were there 3 days.
Okay. All right. So are you breastfeeding, bottle feeding?
Breastfeeding.
Okay. How's that going?
I feel like she's hungry all the time, so I don't know if it makes me a little worried. I don't know if I should.
Did you breastfeed your son?
Yeah.
Okay.
I didn't have those difficulties with him.
Okay.
So I'm not sure kind of what's going on, if I need to switch to formula or.
Okay. All right.
Yeah.
We'll look at her growth and we'll go
Okay.
over that and her weight and we'll explain all that in a little bit. Okay. Yeah, we'll definitely go over that for you. So I'm just going to ask you a little bit about family history. So any health problems with you at all?
No, not really. I
Okay.
had some asthma growing up.
Okay.
And things, but other than that, nothing.
Okay. And how about her dad?
He's been fine too.
Okay. So no hypertension, diabetes, anything like that?
No.
Okay. And then her older brother, any health issues with him at all?
He's had a lot of earaches.
Okay.
So we just had tubes put in.
Okay. All right. How about her aunts and uncles, your brothers and sisters and your husband's brothers and sisters? Any like hypertension, diabetes, asthma, big things going on?
No, none of my siblings. And,
okay.
He's an only child, my husband, so no.
Okay. How about Emily's cousins? Anything? Health issues?
No.
Okay. All right. And then your parents and your husband's parents, any health issues with them?
Nothing's big or serious. Everyone's been pretty healthy.
Oh, good. That's great. That's great. So she's only 2 weeks old.
Yeah.
So no health issues with her over the last couple of weeks.
Nothing's come up.
Okay. She hasn't taken any medications. Have you ever given Tylenol or anything yet for her?
No.
Okay. All right. I know sometimes when babies get fussy or maybe got some cold symptoms. Or maybe ran a little fever at home, you might have given some Tylenol, but you've done nothing.
No, I mean, she's been more fussy at night, but I haven't given her anything.
Okay. And did she have her Hep B immunization in the hospital?
They said they gave her all her immunizations. I think that's listed in there.
Yeah,
so.
okay. All right, so she did have that. So today she won't get any immunizations.
Okay.
But we'll go over the immunizations, what she's due for the next time. Okay. So, what neighborhood do you live in? Where do you live around the city?
We live in Squirrel Hill.
Okay. Do you live in a neighborhood like a plan, or do you live kind of rural?
I mean, there's people around, but it's really quiet.
Okay.
So it's nice.
All right, good. You have city water.
Mm-hmm.
Okay. And your heating, is it gas or electric?
It's gas.
Gas.
Yeah.
Okay. Smoke detectors in the home?
Mm-hmm.
Okay, good. Do you have a carbon monoxide detector as well?
Yeah.
Okay. All right. Any guns in the home?
My husband does have a gun in the house. Yeah.
Okay. How about the ammunition?
No.
Okay, so is it, do you just have the gun and no ammunition, or is it kind of locked, put away?
Actually, we don't have any ammunition
At all, just the gun. Okay,
Just
but
the
is the
gun.
gun kind of put away and locked away?
Yeah, so
Okay.
sure.
Okay, good, good. All right, any smoke exposure at home? Do your husband smoke, or your parents, or anybody that's near Emily smoke?
No.
Okay, all right. So does Emily have her own room? Is she in a nursery? Is she still in with your room?
We have a little nursery set up.
Okay, good. So she has a crib?
Yeah.
Okay, good. And then in your household, just you and your husband and your son and Emily?
Correct.
No other family members live in the home, or no other? Okay, all right. I know you're still home with her.
Yeah.
Do you plan on daycare or babysitter once you go back to work, if you're going back to work?
Yeah, I am actually going back to work, and we're going to put her in a daycare.
Okay, all right. Have you checked any out yet? Have you went and, checked and seen the location, or, looked at the facilities at all?
Yeah, there's one that's close to her house that I have gone to, and we've checked out. I think that's where we're going to go.
Okay,
so.
good. Okay. So do you work out? You work outside the home?
I'm going to start again.
Okay,
Yeah.
all right. And what do you do?
I'm going to work at a school kind of as a, wrap around the kids and helping out. So.
Okay, good, very
Yeah.
good. And then your husband, what does he do?
He's an accountant.
Oh, okay. Okay. Do you guys have each your own vehicle?
Yeah.
Okay. And then do you have a high school diploma, college degree?
I have a college degree.
Okay.
Yeah.
What level? Do you have bachelor's?
Yeah, just a bachelor's.
Okay. How about your husband? Is he college degree as well?
Mhm.
Okay. All right. And then Emily's car seat. Do you have it in the back seat?
Yeah.
Okay. Is it rear facing?
Yeah.
Okay, good. Good. All right. So just going to now ask a little bit about Emily's diet. You say you're breastfeeding.
Yeah.
About how many hours is she going in between feedings?
It's about 2.5 hours.
Okay, and then how long do you feed at each interval? Like, do you do 10 minutes on each side, or?
Yeah, it's been about that.
Okay. Okay, but you feel like she's not
She seems like she's still hungry.
hungry?
Yeah,
Okay.
and I don't know
Okay.
why or what.
Okay. No worries. We'll go over all of that. Is she having a lot of wet diapers during the day?
I mean, probably around every feeding she has a wet diaper.
Okay, so maybe 7 or 8 a day?
Yeah, I guess so.
Okay. And then her stools, how many stool diapers is she having?
About 2 or 3.
Okay, good. Do you remember the color or consistency of her stools?
It's like a yellowish
Okay, good.
color.
Yeah, it will be that because of the breastfeeding.
Okay.
And then her sleeping, how is she sleeping?
During the day, fine. At night, not so well.
She's awake?
Yeah, it seems like 10 o'clock hits and she's like, she's
Okay.
just been fussy.
Do you notice like a lot of gas? Is she kind of pulling her knees up a little bit during these times, or are you?
I haven't noticed that.
Okay.
I mean, sometimes, when she does go in her diaper, like she'll strain, but I haven't noticed like a gassy kind of.
Okay. You didn't notice her being constipated or little beads or pellets when she.
No.
It's been like a normal soft kind of consistency. Okay. And then, is she kind of following you now? Like when you're feeding her and maybe somebody walks in the room, is she kind of following? Do you notice?
I notice it more, I guess, like with toys. Like if I have something,
okay, good.
She'll
follow it.
Yeah.
Okay, good. All right. So, do you notice that she's kind of awake during her feedings? Or is she kind of wanting to sleep a lot? Or is she kind of alert?
She's pretty alert.
She's alert?
Yeah.
Okay. And when she is crying, does she kind of calm with your voice? Does she?
Yeah, I mean, she'll start to settle down, but she's still been kind of just fussy at night.
Okay.
So.
Are you doing tummy time at all? And is she kind of trying to lift her head up a little bit when you put her on her tummy?
Just a little bit.
Just a little bit. Yeah, she's still only 2 weeks. So as long as she's like attempting to want to lift it, that's a good thing.
Okay.
That's a good thing. So any issues that you are having that you want to talk about with her other than the feeding? Do you notice anything, any rashes on her at all? Any skin issues?
No.
Anything with her eyes that you notice that's odd or that you want to address?
No, I mean, the only things I guess that, I've been concerned about is just making sure she's getting enough to eat, and then, her being kind of fussy at night.
Fussy at night. Okay.
I'm tired.
Okay, yeah, absolutely, absolutely. All right, so I'm going to wash my hands,
Okay.
and then while you're holding her and she's content, I'm going to listen to her heart and lung sounds, okay, while she's quiet. Because some parts of the exam she's going to want to scream and cry, and then I want to be able to listen, okay? All right. So let me just wash my hands. She is pretty content being there in your arms.
She's fine right now.
Until about 10 or 11 o'clock at night, right?
It's like when I'm ready to sleep and she's
Yeah. Aww.
wants to be up.
Yeah. She is precious. All right. So first I'm going to listen to her heart sounds.
Okay.
And then I'm going to count how many beats per minute.
Okay.
So I'm going to listen for a full minute. So I don't want you to think anything's wrong that I'm listening so long.
Okay.
It's just that I need to count.
Okay.
Okay? All right. Hi. Let's turn this over to this small one. All right, so I'm just gonna have you sit her up just a little bit so I can listen to her lung sounds. And the same thing for her lungs. I have to count her respirations for a minute, okay?